G'day everyone, welcome back to the channel. So in today's video, I want to talk to you about sacroiliac joint pain. And more specifically, I want to talk to you about the role that stiff hips play in creating SIJ pain. I think it's a part of the condition that gets missed a lot, considering that a lot of SIJ pain tends to be very specific. We tend to be able to find and palpate that soreness over the pelvis. We tend to look at pelvic floor strength and how the low back relates to the SIJ. But we often forget or neglect or overlook at least the role that stiff hips play in that process. So I think with a lot of SIJ pain, rightfully so, we're looking at the pelvis and saying, look, is there an upslip? Is it rotated? Is it asymmetrical in some way? And that can obviously generate or be a strong cause of why the joint themselves become sore. But again, anatomically, we need to look immediately below that SIJ because the hips are the next mobile structure. So if your hips have become stiff, and again, if you've been a fan of the channel, you know that sitting has a strong role to play in most musculoskeletal dysfunction. But in this case, the more that you sit in that sort of 90-degree hip position, those hips get stiff. When we lose that natural hip range, then obviously your body has to try and make up that difference somewhere else. And the SIJ, when compared to the hips, is a far less mobile structure. There's obviously some subtle sort of rotation that happens when we bend and twist, but for the most part, it's designed to be a stable joint so that we can transfer force from the legs up to the spine and vice versa. So if you then stiffen up the hips below that joint, then we start to introduce more load and more forceful movement through those SIJs than it's designed to handle. So if you're someone who's been struggling with SIJ pain for a long time and you haven't really taken a look at your hip flexibility, then hopefully these next couple of exercises are going to be really beneficial, because the more slack you can feed into those joints, the more we allow those SIJs to do what they're supposed to do, which is be stable and have some subtle controlled movements depending on what you're doing with your body. So the first exercise that I want to get to basically revolves around jamming a ball into your hip muscles. Now, this isn't fancy in any way. We're going to go looking for tightness. It's probably going to be a little bit tender depending on the person, but we're going to start through the piriformis. We're going to start through the muscles at the back. So essentially we want to make sure that the ball doesn't go in the leg. We want to make sure that the ball goes into the back pocket area. So we're going to place it basically into the heart of your butt cheek. We're just going to get you to lie down. We're not doing anything fancy here, but the idea is we want to move the ball around until you find something that feels tight. Now, again, if you've been a fan of the channel for a while now, you'll know that we don't want the ball to roll around. So once you've found a spot that feels tight and tender, I want you to stay there and I want you to do other things instead. So what I want you to do is I want you to take a deep breath in. I want you to tense the muscle that the ball's digging into, almost push the ball away by tensing it, hold it for about 5 to 10 seconds. And then when you relax, you should feel like the ball sinks in easier, it feels less tender, it should feel better almost immediately. Now, it might be a small change, but it should be a change nonetheless. So same thing again, find a spot that feels a little bit tight, a little bit tender, deep breath in, give that muscle a squeeze, hold it for a few seconds, and then we're going to keep repeating this process. So I want you to go hunting around the back of that hip joint. You can come around towards the side a little bit more, but muscles towards the back, the more hip external rotators like your piriformis, tend to have a much more connected role to play in pelvic joint dysfunction because of their orientation and their where they're attached to around that area. So again, you're only really sort of hunting around for what you can find. And again, it'll be very specific to you because you'll know what you find. So again, just hunt around there for a little bit. The other thing that we can do with this, and again, if a lacrosse ball is a little bit too brutal for you, feel free to use a tennis ball. But the other thing that we want to get you to do is once you've found one of those tight spots, I want to get you to use movement to shear that free. So for example, I can find another tight spot just here. Once I've done my tensing for a little bit and then relaxing, tensing, relaxing, I want to then internally and externally rotate my hips to shear free some of that tight soft tissue. So again, we're trying to use movements to improve movement essentially, which is a very strange concept when you think about it, not really. So again, if you have your knee bent a little bit, you probably target that piriformis a little bit more. When you straighten it out, you might find you can get a little bit more movement. But again, at the same time, we're doing what you find is most important. So that external internal rotation of the hip really biases some of that tight tissue. Again, if you need to get that leg out the way, you can. And the other thing that you can do in this position is you can very, very gently bend and straighten that hip out. Again, we're trying to shear free some of that tightness. moving on to another spot, get that tissue to free up. So again, we're trying to feed some muscular slack back into those hips to allow the pelvic joint, which is literally right next to it or right above that, afford that more sort of normality, in otherwise it wouldn't. So that's exercise number one. Now, exercise number two basically involves a power band or a jump stretch band or a monster band, whatever you want to call them. You don't necessarily need this, but I'll show you how to do the exercise because we're going to do a hip capsule stretch. We're going to go for the deepest stiffnesses in the hip through that capsule. So you can wrap a band around the hip to emphasize the exercise, but we'll do it without just so that you can see. So again, what we want to make sure that we're doing here is much like most exercises, we want to make sure that the body's in a good position. So when we're on our hands and knees, essentially how this is going to look is that we want to make sure that you take one leg back, so take the leg back that you're not using. So we're trying to stretch this left-hand side. What we basically want to do here is we want to imagine that that thigh bone is pressing out the butt cheek. And we went through this in a video a couple of weeks ago, so if you want to scroll back and see it a little bit more, you're welcome to. But the idea basically is we want to keep our shoulders and our hips integrated. We're going to come across towards the side that we're trying to stretch. Now, as I said, we don't want the hips to just go on their own. We want everything to shift across to the point where you start to feel a little bit of pressure from that thigh bone pressing out to the back of the butt cheek. Now, again, if this gives you any SI joint pain, then find a position or find a depth of the stretch that feels very tolerable and start there. As this frees up, you'll feel you can go a little bit further. You're not going to end up going too far. You sort of go past the ability to stretch here, but essentially want to come across, let that thigh press out the back of the butt cheek. This is a fantastic way to bias that deeper hip joint capsule that gets missed a lot, particularly with SIJ pain. So this is part 1 of 3. So you want to be in this position for about 30 seconds, 60 seconds, whatever you feel comfortable with. The next 2 positions are similar. We're just going to put our foot in a different position, rotate our leg to bias different parts of the capsule. So for part number 2, what we want to do is we're going to rotate that foot under, and we're going to drop that back leg just to block that position. So we're going to bias external rotation of the hip. And we're going to do the same thing again. We're going to come across together as a unit. Again, you'll feel this will hit a little bit more towards the back where you had the ball before. The first one was a little bit more at the side. Again, we want to stay here for about 30 seconds or so. Allow that tissue to give, allow it to free up, and then move on. And once we've done that for about 30 seconds, what we want to do is we want to do the opposite. So we want to internally rotate that foot or that leg, not to the point where we start to take our hips and our back with it. We want to stay nice and together, rotate out as far as you feel comfortable, plant the foot, and then do the exact same thing again, shifting back across to find that pressure. And again, for this internally rotated position, you should feel that a little bit further towards the front. Again, it shouldn't be groin territory. It shouldn't feel like you're pinching. If it does, then don't go as deep into that hip flexion. Come out of it a little bit more, but still be across to that left-hand side, just to make sure that we're capturing that sort of lateral hip tightness. Again, staying here for a few seconds, 30 seconds, 60 seconds, making sure that you see a change, and then coming back to it. Now, if we're using the band, all we're doing is just hooking the band up into the crease of the hip joint in this position. So essentially, you can do it with the band pulling backwards to distract that hip. I like to do it with the band coming out to the side for obvious reasons. We want to distract that hip laterally so that when we come into this position, you can feel like you get a little bit more room to move. So if you have particularly stiff hips, and you feel like the non-banded version of this stretch doesn't hit it quite perfectly for you, grab a power band, grab an old inner tube with a bike tire, grab some TheraBands tied to something so they don't move. Grab some elastic band to pull that hip apart and allow you to stretch that a little bit further. So interestingly, with a lot of SIJ pain, we can affect how that feels by doing things around that SIJ. And in another video, I'll come back to talk about the role that the lower back plays in SIJ pain, so please keep an eye out for that. As a little bit of a spoiler, it's a fantastic test to do as well, because there's a lot of SIJ pain that isn't actually coming from the SIJ, it's a referred pain from the lower back. So if you're someone, again, who's been struggling, say you've worked through all the hip stuff and you feel like your hips are really mobile and your SIJ pain's still there, excuse me, then obviously we can take a look at your back and see if that back's referring down lower. So when I put it up, I'll link it in the description. But in the meantime, if you went on to enjoy this video, please leave a like below. Let me know in the comments how you're going. And then obviously subscribe to the channel if you're new, just to help us grow a little bit more. But in the meantime, thanks for watching. We'll see you soon.